Transgender people have specialized health care needs and face disproportionate barriers to accessing proper treatment. The Obama administration attempted to address these challenges by extending non-discriminatory protections to transgender patients in a 2016 provision in the Affordable Care Act. Trump has declined to enforce that legislation, and this month finalized a rule expressly removing protections for transgender patients against discrimination by doctors, hospitals, and insurers. A landmark decision from the U.S. Supreme Court, also released this month, interprets sex discrimination to include gender identity and sexual orientation when it comes to workplace protections, and will likely have far-reaching implications, including in education, housing, and health care. At least one lawsuit, led by a collection of LGBTQ+ health clinics, has already been filed to block Trump's attempt to remove protections for transgender patients following the SCOT-US decision. But many healthcare providers and the Centers for Disease Control and Prevention (CDC) agree that a policy of non-discrimination does not go far enough to ensure equitable and sufficient treatment for trans populations. Experts say understanding the specific needs of transgender people, and the difficulties they often face in accessing health care, isn't just crucial to addressing such disparities, but to saving trans lives. Compared to the general population, transgender people are 4 times more likely to live below the poverty line and twice as likely to experience unemployment and/or homelessness, according to a 2011 national study. The prevalence of discrimination and violence against trans people is also staggering. Nearly half the respondents in a 2015 study reported experiencing some form of harassment or worse. For Black and Latinx trans women, rates for poverty, harassment, and violence are often twice as high as compared to trans women overall. Such conditions partly account for correspondingly high rates of depression, anxiety, substance abuse, and suicidality among trans people, according to the CDC. Often the procedures that a transgender person might pursue are perceived as cosmetic, when in reality they are life-saving procedures. Reliance on survival sex work to meet basic needs like food and housing has led to disproportionately high rates of HIV infection among trans women, and particularly trans women of color. The risk for transmission of HIV and other blood-borne infections is also heightened when strategies for body modification, such as hormone treatment and silicone injections, are sought on the black market. Body modification is a medical necessity for some transgender people, and ought to be treated as such, not just because of the risks pursuant to seeking it outside clinical settings. We know that transgender people having access to gender-affirming care, which is health care that's directed at helping their bodies come into alignment with their experienced gender or gender identity, improves health outcomes across the board, says Amy Weimer, MD, medical director of the UCLA Gender Health Program. The purpose of such care goes beyond patient needs around gender transition, which Weimer says varies for each individual and may or may not include hormone therapy, surgery, or other medical interventions. Often the procedures that a transgender person might pursue are perceived as cosmetic, when in reality they are life-saving procedures, says Weimer. For a transgender person to feel their appearance more closely aligning with their gender experience directly improves mental health, Weimer says, which corresponds with lower rates of substance abuse and suicidal ideation. Body modification may also reduce the likelihood that they'll face violence, discrimination, and harassment for appearing easily identifiable as transgender in unsupportive environments. If we have a care model where people can access health care in an equitable way, we can attend to all of their general health needs beyond transitioning, including HIV prevention and the type of preventive care, like screening for cancer and diabetes, that improve health outcomes for any population. But transgender people often hesitate to seek care, even when they're sick or injured. One study found that 28% of respondents postponed medical care due to discrimination, the same percentage that reported actually experiencing harassment in doctors' offices. Nearly 20% reported being refused care because of their gender identity, and nearly half didn't seek care at all because they couldn't afford it. Most providers have never been taught anything about how to interact in a productive way with a transgender patient. While under existing state and federal laws it's illegal for most private insurance companies to deny transition-related care deemed medically necessary, many continue to do so, according to the National Center for Transgender Equality. Around 15% of transgender Americans are uninsured, compared to 11% of the general adult population, and have to pay any health care expenses out of pocket. Covering medical costs can be another motivating factor behind survival sex work, fueling a cycle of risk and negative health outcomes. What's more, many providers lack knowledge of how to interact with and treat trans patients, a major institutional obstacle. One study found that half of trans respondents felt they had to teach their own doctors about transgender care. Most providers have never been taught anything about how to interact in a productive way with a transgender patient, Weimer says. We in medicine hate to feel ignorant, so if we have not been exposed to how to approach that care, we're averse to doing it for fear of making a mistake. Even encountering one trans patient during medical training could make a significant difference, Weimer suggests. The most important thing is just to introduce transgender people as another vulnerable population with health disparities that we need to educate providers about directly throughout our health system.